So we're gonna wait for our friends to come on, right? Hey, Sean. Gonna wait for more people to join. Hi, Chris. Just chilling, waiting for more people to come on. I'll start talking in a little bit. This is Chloe. That's right, MVP. Hi, Sarah. Say hi, Sean. All right, so I'm gonna wait for a few more people to join. I'm gonna start going off some of the questions I've gotten from a lot of my followers. Hi, James. Hi, Tom. Hi, Ed. Okay, so we're gonna get going. I'm gonna start with a little bit of my background. As we go, if you guys wanna throw out questions to me, please do. I'm gonna go over, I have a few questions on here that I've gotten from you guys over the week, DMs and some emails. So I want to start off by saying thank you for joining. And I wanted to talk about what we wanted to do as in terms of starting off. A lot of people had asked me about how I started off, why I wanted to do PT, and why I am where I am today. So as a young girl, one of my good friends was diagnosed with lung cancer, and she loved going to physical therapy. And to me, being able to see her, brighten up because of it was such a huge role into why I am and where I am today. I knew that being a person in a profession where you can make someone happy and heal them was amazing. I love the heart. I always thought about doing cardiothoracic surgery, but I didn't really want to do the years of med school or the time. I would have been like 35, 38 probably by the time I was done with a bunch of loans. Not that I don't already have a lot of loans today, but the biggest thing for me was I wanted to make people happy, and I wanted to be happy. I watched my mom struggle. Her and my father had great jobs, and they got outsourced when they worked in a company for X amount of years, almost 28 years, and they also said to me, do what you love. And PT really stood out for me. And watching my good friend go through something like that and see how beneficial it was to her, I was like, man, I want to do that. And at the time I was like, maybe I want to go through a pediatric route, or do I want to go through sports and fitness? I decided that I wasn't sure. So I knew I wanted to do it, and I started right from the get-go. 16, 17 in high school, I started as an aide. I started off cleaning tables in the PT setting, an outpatient setting, small place at home. I knew everyone. I would meet all the old people that walked through. I learned a lot about the high school athletes that stepped through, from ACL injuries to meniscal injuries, and I really got my hands on. And the guy and the doctor that I learned under, he started realizing how much I really enjoyed, and I really enjoyed learning. So he started pulling me into, hi Mark, he started pulling me into the room for the evaluations for incoming patients, and that was really exciting for me. So I actually got to see firsthand a physical therapist do a full thorough eval, and that was huge for me. I loved how you had to use your skills, you had to find out what was going on, because not necessarily every case is the same where you get an MRI or you get a script from the doctor. And even when you get one of those, it doesn't really matter, because you're going to make the plan of care. You're going to make each day and each session that you have with that patient based upon what's going on in their lives. It's not based upon their MRI, and that's something I want to touch upon because I've gotten a couple questions about that. So I started off 13, wanted to knew what I wanted to do, pretty much 13 to 16, got into an aid setting. And it's difficult because a lot of people, I hear from a lot of kids today, actually have 2 students that want to start with me, getting volunteer hours. It's free. You're in a setting and you're doing it for free. And that's hard, especially, you're 16, 17, you want to save money, you want to put money away for school, and you're working for free. But the experience is huge. So I had to balance a lot of that. I balanced working in a hospital for a whole day, and then I would lifeguard the other days. And then there was one year where I worked and I actually got the PTA job. So I was working as aide, I was getting paid, and I was getting the hours in it and the experience. So there's so many different settings you can go into in the PT route. It's just which one do you feel comfortable doing. And, going off of my friend dealing with chemotherapy, I was like, well, maybe I want to go into the setting where I work with cancer patients. And hey, Eric, and myself, I don't know how many of you guys know, I went through breast cancer a couple years ago, and going to the doctors and going to the hospital and stuff like that kind of turned me away in the middle of med school from going that route. Not that I wouldn't do it, I just don't know if I could do it, my whole life. So I really took a liking to the sports world. Hi, Chloe. Thanks. Okay. So I was always great with human anatomy. I loved the biology of the body. I loved the way it worked. I loved mechanics. That was the one part of physics that I actually enjoyed, was learning about the joints and the mobility of the joints. So I knew I wanted to go that route. And then, as most of you know, I went from a powerlifting background to a bodybuilding background, which I know some of my powerlifters on here are going to say something, but I loved it. I loved everything about mechanics. So I started going more into a sports and orthopedic route. So when I was in between undergraduate and graduate school, I started working as an aide back in the clinic at home that I'd started out as a volunteer when I was 16 or 17. And then I took up an aide position at the hospital, so I got a lot of good hands-on skills in the hospital setting. So I got to do some inpatient shadowing where I got to see people out of the ICU and learning whirlpool techniques, people right out post-op, getting people to stand after they got a stomach bag put in. And that was a lot. I didn't think it was as exciting to me as I really fell in love with the orthopedic route. So I got my hands on everything. And even in PT school, I did a pediatric rotation, which made, my expertise now huge. So I'm able to balance between, I have patients that are UFC fighters to I have a 7-year-old little girl that I'm helping to walk. So it's really helped to broaden my horizon to get my hands on that. And I'm actually grateful for those experiences. So if you're a student and you're trying to get hours, I recommend getting into different settings and just seeing what you like. You don't have to let it be the end all be all. And I think that's what a lot of kids set their mind on. They go to school thinking they're going to do something and they're set on it, and then it changes. So play around with it when you have the time, because when you get out, you can also play with it, but it's also kind of hard. Like now, if I think about it and I go a neuro route, I have to really kind of change my knowledge and my skill set upon more of a neuro-based PT setting than I would my strengths in orthopedics. So going off of that, when I was in PT school, I also was getting ready for my first bodybuilding show, and it was rough. I worked 2 jobs, and I went to PT school full time. What PT school did I went to? New York State Institute of Technology. It was in Westbury on Long Island. And I didn't think I was actually going to go there. So fun fact about that, I didn't get into PT school my first year. And I know a lot of people are struggling because of how competitive it is, or they get down on themselves about that. So my point of this is to keep it up, keep the effort up, because the whole reason I didn't get into PT school my first year was because of my GRE, which is pretty much a higher SAT in my eyes, and it had no bearing on who I was. My knowledge in PT, my knowledge in science, my grade point average was flawless from undergrad. So the fact that I got denied my first year was like a kick to the stomach. But so I went home and I lived at home for that year in between graduate and undergrad, and I worked more. I got more experience. I got myself in different settings. I did the hospital, did my outpatient, and I just worked. I worked. And then I reapplied again, and I finished, I edited my paperwork. I had people look at my essays and stuff like that. And I got really good recommendation letters after that. So I applied to a lot of schools. I applied to St. Augustine in Florida, New York Institute of Technology, Stony Brook, I think Elon, and I think that was it. And I first got an interview with NYIT, and I went. And I didn't think I wanted to. I think I really wanted to come down to Florida. I wanted to go to St. Augustine. And I really want to go to Stony Brook because it was closer to home and it was obviously cheaper. But when all was said and done, I picked NYIT because they had an amazing staff of professors. The class size was like 35, I think, or 38, compared to Stony Brook, which was like 85. And I wanted to be more hands-on, and that's just the type of learner that I am. I'm more visual, more hands-on, and I knew at NYIT I would get that. And my whole experience with NYIT was just like a home, and I really wanted to just stay there. So it's funny because the first year I got denied from everything, and then I got in. So that's okay, Cassidy. Hi, thanks for joining us. Brandon had asked me, did you take the jurisprudence exam when you moved to Florida? I had to take the Florida State boards. So I moved to Florida before I even graduated, which was funny because we had like a month of getting ready for the boards exam. And I moved to Florida actually before graduation. So I flew back and forth a couple of weekends and finished up the tail ends of getting ready for the boards. And then I graduated, flew down. I already had a job set up for me, and I took the Florida State boards exam, I think June. I think I graduated May 22nd, 2016, and then I took the state boards exam that June, and then I took the boards July, and I passed. So it was, I was already down here permanently. But New York doesn't require a state exam like Florida does, so I didn't have, if I were to stay in New York, I would have had to do that. Cassidy, now that you joined on, I actually wanted to answer your question. So Cassidy is finishing her prerequisites for OTA school, which is occupational therapy. And she had asked me why I decided to choose PT over OT because of how hands-on both of them are, and they're very, very similar. And I knew, I don't know, Cassie, if you heard me from the beginning, but I knew that from the beginning I wanted to do PT because I was in that setting when my best friend was going through chemotherapy, and she worked with a lot of PTs, not OTs. I'm not sure why she didn't do any OTs, but I think that was just from what was going on with her. And I knew then that, I wanted to have a job that made people happy. And then I got really into the sport side of things as an athlete. I was a runner. I started off running, then I was a powerlifter. And then I got really into the PT setting, and where I ended up working out by me where my family lives, there, aren't really major hospitals. It's there's some skilled nursing facilities, and then there's one main orthopedic setting, and that's where I ended up working. So I really ended up loving that setting. I loved evals. I loved diagnosing. I loved special tests. I loved figuring out, someone comes in with a shoulder injury, and I can tell you, what tendon or what rotator cuff tendon is being affected. And I think that really set things off for me. So you said, I think my biggest part is I want a job that makes me feel good and I get to help you. Exactly. And PT, OT, you get the same thing. I worked along occupational therapy. My first rotation, it was a skilled nursing facility. And I actually loved the OTs that I worked with. They were just phenomenal. And when you work alongside an OT, it's amazing because you guys also know a lot of functionality stuff, as do we. but it plays a huge part when you have someone that you're working together with. So OT is a beautiful way to go. I don't really, besides maybe salary, but I don't even see that much of a difference in salaries now with OT versus PT. And a lot of programs do a dual. They do a PT and OT. I know that some people have gone that route too, but it's a beautiful profession. It really is. I'm very grateful that I went this route. So, going back to, I wanted to look at the question I got here. Going back to I grew up in speech therapy because of a lisp, so I love the therapy field. Yeah, I mean, that's huge too. I worked alongside a lot of speech therapists when I did my pediatric rotation. I worked alongside actually then too with OTs. I did a peds rotation in a school setting with kids who were severely handicapped from like 3 to 5. And I love the PT, OT, speech. It just ties together beautifully. And when you have when you have a network of clinicians like that working with a kid, parents love you too for that. Parents really appreciate the time that you guys put in, and that you guys sit around on a board and you talk and you discuss the child and you make up the best prognosis for them. So, whether it's an adult or it's a child, it's a beautiful profession. So anyone who's joining on, if you guys have questions for me, please ask. I'm just going off of some questions I got this week. So another question I had from someone was, what's the best way to study anatomy? And anatomy is a lot of memorizing, but you can make memorizing into knowledge. Meaning, when I took gross anatomy, and I know everyone learns differently. So, you have people that are visual learners, you have people that are more textbook. I am someone who's very hands-on. So the first semester that I had in PT school, and I don't know if that's different for other classes, was anatomy, gross anatomy. So we dissected the human body. And dissecting the human body sounds disgusting, and I'm sure some of you are like, what are you talking about? But it was the best experience I could have had. Hey, Debbie. So everyone kind of was like crazy, but dissecting the human body was the best thing I could have done, because knowing the body from the inside out and the layers upon layers upon layers was huge. Hi, Tia. How are you? So when you actually know the inside of the body, what it looks like, the way the nerves are patterned, the way the fascia lays, the way the organs are laid out, it's pretty awesome. I love it. If I could be in dissection lab every year, I would. And I would love to find a way to do that, but I don't know if that's like people's hobbies and stuff. I mean, I would make it a hobby. It's just really awesome, and you can really just learn so much about it. That was the best thing. If you can get hands-on like that, amazing. Or you get index cards. There are so many virtual labs out there. There's apps. There's one called Musculoskeletal Anatomy. I was actually showing one of my students that the other day, and one of my patients who's actually in school for doctor of osteopathic. But, you have to learn the muscle's origin, the insertion, the nerve that innervates it, the blood supply. You need to know all of that, because it plays a part when you become a PT or you become an OT or you become anything in the field. Because if you know where the muscle originates, and you know where it inserts, and you know which nerve's affecting it. If a person has an injury, you know how to manipulate it. You know how to affect it, make some sort of mechanical change to it. You know how to fix, or at least start the process of healing. So anatomy is huge. I think that's the basis before, if you're going into PT school, something you could probably touch upon. And at least what I got recommended was knowing, I went into different regions. So I did the back, and then I did the upper extremities, then I did the lower extremities, and then the facial muscles, and so forth. And when you know that much detail about motion, then you can really tie it together when an injury happens. But going off of that too, you also want to know the bones. The bones are important too. The bones and the bony markings on, let's say you take your arm bone, for instance. There are so many different markings on that bone that tell you where your rotator cuff inserts, that tells you where your bicep inserts, which tells you where your lat inserts. And if you know those, then you also know bony anatomy. You know when to palpate something. You know when you're feeling someone's shoulder and rotating in and out. You can tell if they're tender there, that's positive for maybe rotator cuff tendonitis. Or going over a little bit closer into the shoulder, you can feel for more bicipital tendonitis. And if you don't know that, and you don't know your bony landmarks, you can't be finding a solution for people's issues. And it's so important, like I said, knowing the anatomy, knowing the bony tissues as well as the musculature before you go into PT school. And it's going to help you substantially. But even if you're a trainer, even if you're a massage therapist, it's really good to know all that stuff too. Hold on. Powerlifting, keep hurting yourself, you learn anatomy. Yes, my powerlifters really keep me going, and they keep me on my toes, that's for sure. My powerlifters keep getting injured, and then they get better, and then they get injured, and then they're back. But they're awesome. Griff MC11, back got re-injured. Any exercises to prevent this from happening and repair? So, very general, but I'm going to try and spit this to you. If you are an athlete, the biggest thing I can tell you is to start with the McGill Big 3. That's a modified sit-up, a bird dog exercise, and a side plank. And if you look those up, if you look up Stu McGill, excuse me, amazing stuff. You can really start learning how to stabilize your spine from a front to back, from a side to side. And I always say, like, if it's general, like a reach out like that, and I can't assess you and I don't necessarily know what's going on, I always recommend as an athlete to start incorporating the McGill Big 3 into your program, because it helps provide that stability to your spine, especially if you're someone that's an athlete, whether that's powerlifting, that's bodybuilding, that's swimming, that's fighting. My fighters do it. It helps build up some sort of stamina and the deep core around the spine. This is what makes you an amazing doctor. Oh, thank you, Debbie. Okay, so some other questions I had asked. Oh, and I get this one a lot, actually. So, Eric, I think if you're still on here, you'd have just asked me that today. So I know that there's these tools that have come out. They're called the Theragun, and then there's also another one called the Hypervolt. And I actually watched this girl. I follow her. She's a pretty awesome PT, but she's really into helping other PTs get the word out there about the profession. And she did you're welcome. She did a whole study on the difference between the Theragun and the Hypervolt. Now, a lot of people have asked me why I don't include this into my treatment. I don't really have the answer for that, except that, not that I think it's an overpriced gun. I think it's great. I think it's something that you guys can use at home. I don't necessarily think that specializes me enough for you guys to want to come in to see me. Now, the Graston, for instance, I went through 2 courses. I had to sit down and take a test. I had to really know my stuff for that. And it's you're right, it is expensive. Those guns are really expensive, and I think that, if that's something you guys want to have at home, I think that's great. But at the end of the day, I don't know. I don't think it's necessary for me to have in my toolbox. I think that's something you guys could have at home, and I maybe can instruct you to use it. I think that might be better. Chloe, shh. Okay. Hey. Sorry, guys. So, I have heard that the new Theragun that came out is a lot quieter than the first one that came in. And I think that the Hypervolt is a little bit quieter, but I think also the pieces that come with it are more comfortable on the Hypervolt. And I think the Hypervolt is a little bit more comfortable from what I've heard. So I don't know. Right, Sean, $2.99 for Laxball. Laxball does a lot. And you're right. So, the funny thing that you say that, Sean, brings me to this point. When I first started off knowing that I wanted to open up my own practice or start my own business, I didn't have much. I had a table. I had old resistance band that I brought from New York. I think I had a 5-pound dumbbell. And they were like uneven colors, so I don't even know where I got them from. And that was it. And guess what? I was still able to help people with just that. And if you guys scroll down on my Instagram feed, I actually did a video of a man that I helped when I first, my first year of working down here. and I only had resistance bands and a table. And I was actually talking to Andreas, I don't know if you guys know Bod Mechanic, about this, because he was like amazed by the whole fact that I had done this. But I had a guy come in to me and he was electrocuted, and they told him he would never run again. He walked with a very toed out position, and he kind of walked with a straight leg and would circumduct or rotate his hip to walk to clear it. And doing that, he was just very frustrated in his head, and he had actually been dealing with a drug addiction from that whole thing. So, you know, I started working with him obviously when he was clean and in the rehab process. And a lot of it was depression. You know, a lot of the stuff that people go through when you go through an injury is psychological. It's not easy to go through a major traumatic injury or a setback like that. So I didn't have all the tools that all these, you know, that these people have now. And I'm one of them. I have a lot of tools. But my point of this whole thing is that you don't need all that stuff to be a great therapist. If you have your knowledge and you have your hands, you can make a difference. I always tell people, when you see people on the internet putting all this pressure on people and bruising people, I mean, I bruise people with the cups, but you don't need that. You could literally push like this and you could make a difference in someone's tissue. You do not need to be bruising people. You do not need to be digging into people. There's a time and place for it. But when someone is really hypersensitive and like really having an issue with a piece of their body, you don't need to be digging into it, right? You have to really calm the nervous system first and then start digging in. And a lot of my clients will know when you start out with the Graston, it's not comfortable. And then as you do it, hey boob, how are you? So when you start doing it and you do it regularly, it becomes more comfortable because your nervous system becomes accustomed to it. But going back to that story, I worked with him. I did a whole evaluation on him, and he had muscle firing. So I was like, there's no way that someone told you that you'll never be able to run again, because he had some firing of his hip flexor. He had some firing of his quad. It was very, very little, but he was able to. Hey, Mike. So the point was is that we got him going. I did a lot. I didn't even have stim. I didn't even have electric stim with me. I did a lot of tactile cueing, so I did a lot of tapping on his quad, and I did a lot of tapping on his hip flexor, and I did a lot of tapping on his anterior tibialis to get his toe to start dorsiflexion, so lifting up. And we progressed. So we did a lot of walking stuff. We did a lot of neuromechanics. We did a lot of isometrics. Then we did concentric strengthening. Then we were able to do eccentric strengthening. Then I got him up doing resistance band stuff. Then we got him jogging. Then we got him doing agility stuff. Then we started working different planes, and all of a sudden I got him to be doing a sprint. And it was amazing because I had nothing. I literally had nothing. I had a table, I had resistance bands, and that was it. And some lotion. But I didn't even really massage him or work on him unless he was tight. And he's back to running full again. And he always reaches out back to me and like thanks me. And he was in like these crazy clinics doing all this stim stuff and nothing. He left there, and obviously his drug addiction had started and it went to that. So the fact that I could change someone with very little, it just goes to show. I mean, I get it. Like, putting that stuff out on the internet is, you know, you get followers, you get the hype, you get all that, but you really can make a difference in someone's life just having the knowledge that you have in your hands. That's it. You really can make a difference with just that. So that's why I'm not really about all those crazy hyper, you know, whatever, Theraguns, Hypervolts, all the stuff like that come out. I'm looking into some other things that are, I think, will be pretty useful in my, you know, in my hands, but other than that, I think that like you can really make a difference with functional exercise and your hands and the very minimal stuff that you need. But that's me. That's my opinion, and that's what I've at least noticed in my career so far. So what was your major in undergrad? Does a certain major look better than others for getting into PT school? My major in undergrad, I majored in biology. I got my bachelor's of science in biology, and I minored in personal training. So as I was going through graduate school, I actually worked as a personal trainer, and it helped me tremendously because I would get the patients or the clients in the personal training setting that all the other trainers didn't want to work with because of how some of these people that would come in with, you know, maybe bilateral hip replacements and shoulder replacements, and a lot of trainers would stay away from them because they were fearful that they would hurt them. So they'd always send them to me, so it was great. But I majored in bio. The school I went to didn't have a exercise science major. If that was one that I would have done, like if I went to Cortland, I would have probably done exercise science, but biology was still amazing at my school. My anatomy and phys professor, I took 2 courses in that in undergrad. It was at a college level. And I was so grateful that I had that professor, because he challenged me in undergrad so much that when I took anatomy in graduate school, it was like a piece of cake. It was so easy. And it stood out from other kids in the class that didn't have that rigorous of an anatomy class prior to. So if whatever major you decide to get into, if you're going to get into or go into PT school, I would do something in terms of exercise science or you know, biology. But I had people in my class in New York in my PT class that had changed careers at the age of like 40. You know, they, you know, were, I want to say someone in my class was like a computer tech or an IT guy, and then switched like in the middle of his like 30s or 40s. So you really, depending on how hard you want to work and how much you want to learn, I think there's people that had psych majors. You can really go, you know, into PT school. But I want to say you have to have like anatomy and physiology, some sort of physics. I think they looked at chemistry for me. I'm trying to think what else. But I think if you just have some sort of science background or bachelor's of science, they're going to look at that, or they're going to make you do different prereqs. But it like I said, it stands out and it sets you apart when you have some type of background like that going into PT school. It makes it a lot easier. I know, you know, we had a couple people drop out, and I think, you know, they struggled with the fact that they didn't have that background prior to. So I think that it stands out. And as much as I disliked physics, I kind of wish I paid a lot more attention in physics, because now how much I love biomechanics, I probably would have not have to look back so much as I did. But now, being out in the sports and orthopedic world, I have my biomechanics book open all the time, and I'm always looking at physics, which I never thought I would talk about or look at or want to study again, but here I am. So anything with that type of background going into PT school is phenomenal. All right, let me look at these other questions I got here. If anyone's on that has questions, shoot them out to me. Oh, did I miss one? I have arthritis in my neck, no curve, completely straight, and exercise to do to help. I wonder if you're talking about my brother. So my brother actually had called me, I want to say it was when we were first moved down here, maybe like 2 years ago. And my brother's a state trooper in New York, and he's amazing. And he's gone through a lot of injuries. He's a second-degree black belt, has been active his whole life. But, okay, Betty, take care. I'll see you soon. So, oh, that's awesome. That's awesome. I hope you're doing well. So, going back to that, my brother randomly, out of nowhere, had called me, said he woke up one morning, couldn't lift his arm. What's up, Chris? How are you? So he went to the doctor, and the doctor said, oh, it's a muscle spasm in your mid-back. No. I was like, no, it's not. You don't just wake up one morning and your arm, you can't lift your arm. So I said, it's got to be like C4, C5, or C5, C6 in your arm, in your neck. It's got to be something going on with your neck. He's like, no. The guy said, it's in my mid-back. Doc, I know I'm seeing you tomorrow. I'm icing my shoulder, but should I be heating or icing that muscle strain in my back? Sean, if it's been a few days, I would go with heat. If it's still like 3 days out from when you injured it, go with ice. But let's try heat and just try some gentle stretching on that. And we'll assess what time you're taking off tomorrow. So, yeah, so he couldn't lift his arm. Woke up, couldn't lift his arm. And he was like, no, my physician's right. He's going to give me an injection. I'm like, it's not. It's not. So I said, you need to go get an MRI. You need to go get an MRI. So he went. Lo and behold, his neck is completely straight. And that didn't just happen. He was just born that way. So some of us can be born with a straight neck or straight lumbar spine. The normal curve of your neck, I'm going to bear with my artistic skills right now. You should have a curvature to your cervical spine and your lumbar spine that kind of looks like this. I don't know if you guys can see that. Yes. Whoop. Flying in the wind here. Okay? So you got to have some type of curvature to your spine. Then his was a nice straight line. Like that. So what happened was, in a normal, I don't want to say normal person because he's a normal person. When you have a herniated disc and you have a straight cervical spine, instead of the disc pushing back on a nerve where you end up having tingling or numbness down your leg like you can have sciatica, he had it pushing forward on his spinal cord. And that is a time where you got to go in for surgery. That is something we can't avoid. So lo and behold, a couple of days after he got everything figured out, he was in for surgery to get a fusion in his neck, which stunk for him, but he's doing better. He's not 100% again, but you know, you have to take the good with the bad, because if it was any more severe, who knows where he'd be right now. So, you know, like you said, most doctors are dumb. Not necessarily all doctors are dumb. I'm going to say that not all of them are correct, and not all of them pay attention to detail, and that's unfortunate. But that's like any other avenue in work, you know. Sometimes people get lazy, and that's unfortunate, but that's also why I decided to get out and be on my own as a clinician, because I want to spend the one-on-one time with people. And if some of you have gone to doctors outside and you wait more than you do actually talking with the therapist or the doctor, it sucks. It's a bad experience. The medical field is just really backwards right now, and I don't really know why it's backwards. You know, I think that there's some way that we got to get out there and show the world where we can fix things, and that's part of what I'm trying to do, you know, with my mission and what it is I'm doing on my own, is put myself out there and show you guys that there are real PTs out there, that there are PTs out there that really care, that there are people out there that don't want to just rush you, and you got it. They're far and few, because unfortunately a lot of us can't always just go off on our own. You know, I'm grateful that I have, I don't know if most of you guys know still, that I still work a part-time job in the morning, Monday through Friday, and then go 7 days a week on my own, because I'm not at the point where I can just go off on my own just yet. And that's not to say yet, because I will. I know I will. As the more I can get out there, the more I can show people what real PT is like. I want to get out there. And I'm not knocking the PTs, and I'm not knocking my friends that are in the orthopedic setting that are, you know, doing that 9 to 5 jam. Like, good for you, but I am exhausted from that setting. And that's only me being 2 to 3 years out. So hey John, how are you? Miss you guys in New York. So that being said, you know, when you go to a regular outpatient setting, you're rushed 3 or 4 patients in an hour. And as a therapist, it's really frustrating. I didn't like it. Like, you're rushed. You get maybe 5 minutes with a person. So let's say someone has a knee issue. I really don't have the time to look and fix, you know, if it's their hip that's going on, or maybe it's their ankle mechanics, because the way that insurance works is, if you have a knee issue, but let's say I have you doing a shoulder exercise, and I write somewhere on your insurance, you know, in your daily note that you're working on some type of shoulder issue, but I'm making you do it for your leg. They don't know how that ties in. They don't know functionality. They only know numbers, and they want numbers. So they want to see range of motion, they want to see strength, they want to see something related to the knee, and that's it. But let's say your problem's coming from a left shoulder injury and it's a right knee problem, right? You can't, and you don't have the time to do that. So when you're in a regular outpatient setting, you got to give the person to the tech, you got to give them to the, you know, aide or whoever's there to run them through their exercises. You're not watching. You know, if you have a really great aide and you have a really great tech, that's amazing. But not all settings are created equal, and you don't necessarily always have that. So when I branched out and I wanted to do my own thing, I knew I wanted to do one-to-one care. Is it more expensive out of pocket for people? Yeah. But guess what? You don't have to see me 2-3 times a week. You are going to have one-on-one care. You can contact me. You can email me. I will answer you. If it's 10 o'clock at night, 11 o'clock at night, 12 o'clock at night, I will answer. I will have an answer for you. And that's really what I pride myself on, is being available to you guys. Because it's frustrating when you're dealing with an injury. It's scary. You don't know what the outcome's going to be. You don't know who to trust. And it's something that I can give you guys peace of mind. And if I can show you guys that makes all the difference. Thank you, Sean, because you're right. It is worth it. And I wish I knew now what I know. No, what is it? I wish I knew what I know now back then, but I'm learning. Okay, I saw a question here. Where did you get your observation hours? Sorry for all the questions. Very curious. Don't be sorry. That's what I'm doing this whole live video for. I got my observation hours at a lot of different clinics. I worked as an aide in a orthopedic setting from probably like 16 to, I want to say 21, 22. It was a therapist that I've known for a long time. I don't know if you heard me before. I lived in a small town, so that was the only really outpatient setting I had. So I always had work there, and I always had a job there, whether it was winter break, whether it was summer break. So I was always able to go and do that. And then I did volunteer hours at a hospital, Southampton Hospital. It was phenomenal. And then the next year, they actually hired me as an aide. So that was even really cool, because then I started getting paid for it, and I wasn't just doing volunteer hours. I wasn't just cleaning the tables. I was able to do some exercises with the patients. I was able to be more hands-on. And that's also the difference between being able to do like volunteer work and tech. You can kind of guide them. It depends on the clinic. But as a volunteer, I had to be really hands-off, whereas a tech, I was actually able to be more hands-on. And that helped me tremendously. Where else did I get my observation hours? I think that was pretty much it. I did a couple orthopedic settings. Yes, I did actually 2 orthopedic settings. And then I did the hospital setting. I got to do inpatient, and I did a lot of neuro. They had a lot of neuro patients there, which was, it educated me beyond my years with that. It made PT school really, really easy. I saw a lot of patients who had vertigo. I had a lot of patients who had vestibular issues. I had patients who had spinal cord injuries. So I got to see a lot. And it really stood out for me. In terms of PT school, it made things a lot easier for me. My exercise background really stood out in class. I didn't really have trouble with the TheraX part of things, therapeutic exercise, and learning how to progress patients, I was really good at. That really stood out for me as well too. So knowing my special tests, which are tests that you check during your evaluation to kind of specify, do you have a tendon injury? Do you have a labral issue? Do you have a meniscus issue? And we're able to actually kind of pretty much verify that without having an MRI. And I know, that's one of the questions I got too. That's something I wanted to touch upon too, was, I get a lot of questions like, well, my MRI says I think I touched upon this actually on my last live feed, but I get the question a lot. So I'm going to touch upon it again. Does my MRI dictate what's going to happen, or am I ever going to be able to go and do this again? So, you can take one of these, like I have a couple strongman competitors I know, and they're insane. They're crazy, but they're awesome because they show how strong the human body can be. They have dealt with pec tears, double pec tears in the same year, compression fractures of their spine, multiple herniations, multiple bulging discs, and they're able to keep doing what it is they're doing. Mentally, are they strong? Yes. But they know the right things to do to keep themselves going. So when an MRI comes back and it says, they have 2 bulging discs and 4 herniated, they don't go, okay, well, that's it. I'm never lifting again, right? That's the complete opposite of what you should do. You should start strengthening the structures around your spine, stiffening that up, especially as a powerlifter, especially as a strength athlete. And that's really weird for me to say, because a lot of people are like, what do you mean you want to stiffen the spine? You actually do want to stiffen the structures around the spine, because when you are someone who is lifting thousands of pounds, you have to be able to withstand that pressure. Your spine has to be able to withstand that pressure. If I were to just take the spine out of a human body, pull it right out without the tissue surrounding it, right? Bony joints alone, it's only able to withstand 20 pounds of pressure, right? So now add your tissue, add your discs, add your tendons, add your ligaments back onto that, and then add 1,000 pounds on your back to squat, right? If you don't have any type of strength or structure to that weight's not coming up. Either you're going down or that weight's not coming up. So a lot of these athletes that I train, I do a lot of stiffening of their spine and that stabilization of their core. And that's not sit-ups. That's not leg raises. That's true multifidus, transverse abdominis, diaphragmatic strengthening. That's pelvic floor strengthening, which is our inner core set. And if our inner core set is strong and it's stiff, especially as a powerlifter or a strongman competitor or a fighter, they can withstand, front to back blows. They can withstand side to side blows. Whereas, my ballet dancers, right? I don't necessarily need to stiffen their spine. Excuse me. But you might have to. Hi, Nora. So actually, Nora's one of my pole fitness athletes. So when you talk about stiffening the spine, some of these athletes, you need to protect it. So my strongman competitors, I don't need to tell them, go and do yoga 4 times a week, because that's not going to benefit them. That's going to create the complete opposite. I don't need them to be loosey-goosey. I need them to be stiff. I need them to be able to move. Does that mean that their hips need to be able to be mobile? Yes, because they're not going to get down and they're not going to get their points if they can't get in the pit in their squat. Now, someone like Nora, who is one of my pole fitness athletes, she is a very mobile human being, and all her joints move a lot. So yes, I had to add some sort of component of stability and stabilization to her, but I also am not going to give her the amount of stuff that I'm giving one of my strongman competitors, or I'm giving, one of my fighters. It's different mechanics. It's different functionality. She's also a yoga therapist. So we know that she's flexible. We know that she's able to mobilize herself. Again, what I give her is not necessarily what I'm going to give my strongman competitor, because it's completely 2 different things, even if they're coming in with the same thing that's going on. So it stands out. And again, going back to that MRI, it doesn't define you. So yeah, you could take an MRI of my spine right now. You could say she looks like she shouldn't be walking. And I think that's what doctors mess up with, is that they'll look at a MRI or they'll look at a X-ray and they'll say, oh, well, you'll never do this again. And that messes with people's heads. If someone told me, oh, you can't do this again, well, okay, well, I'm going to try every way which I can do it. And it's amazing. I had a patient of mine, she does triathletes. She does swimming, running, and biking. And if you look at her lumbar spine, it's completely straight. So she has got no curve to it. Kind of like my brother that I was talking about earlier. And the doctor said to her, well, you're never running again. Well, that's what she loves to do. She loves to run. She loves to bike. She loves to swim. Did she have to take a stop from it for a little bit with me? Yes. But she was still able to swim. And she was still able to bike. And we worked relentlessly on figuring out ways to get her back to running. And it made the difference. And when you have someone that tells you, well, that's it, well, no one is going to want to listen, or they're going to stick with what that doctor said and they're going to be depressed. You see nowadays amputees that come back from war and they're back squatting, or they're back doing CrossFit, or they're back doing, not that, you know what I mean? It's a functional sport. The worst thing you could do is be supine. The worst thing you could do is just, woe is me, lay on your back and not move. And that's the complete opposite of what you need to be doing. But when we have something that's injured, we like to think that, okay, we got to stop. Yes, rest is good, and rest comes in its place during injuries. But if you are someone who loves doing what it is you're doing, why are you going to stop? There's got to be a way to do it. There has to be. If it's something crazy, like, I mean, there's athletes out there that don't have arms and legs, and they still compete, and they still get on stage, and they still make it happen. So, you have to look at it like that way. So a lot of athletes that I get in here that say, oh, well, my doctor told me I'm never going to do this again. That's baloney. Unless you have a serious, spinal cord injury, and God bless that that never happens to anyone, but where you are completely paralyzed and you're A on the spinal cord injury scale and there's no flickering of your muscles, I mean, that's a different story. But like I said, based upon an MRI or an X-ray, that doesn't define, your outcome. So I think we have to kind of move away from that. And I think that's on my part as a physical therapist, to get that word out there to people, to show you guys that there is this other world than just like the mill of the run out there in the health field. And it's funny because I've talked to other therapists that agree with me on that, and they'll be in this job for 20-25 years and they're miserable. But we're not supposed to be miserable. Like someone said earlier in this whole feed, well, I wanted to go into OT because I want to make people happy and I want to feel good about that. Half my friends I know that are in the PT setting doing 4 or 5 patients an hour, literally working on 30 patients in a day, if not more, are exhausted, and they're only 2 years out. So let's think 20-25 years from now. They're not going to be wanting to address your SI joint issue or look at how that your ankle could be affecting your right shoulder. No one wants to take the time and do that because you're exhausted. And that's what's crappy about the world, is we gotten to that point where it's just a revolving mill. So I think the big part for me to get out there, and I'm going to try and continue to do my best, and I think my mission as I start my own company over the past year, is to get that mission out there, that there are therapists that can help you, that do one-to-one training or one-to-one therapy. And is it going to be more expensive out of pocket? Probably yes. But are you going to have to spend the least amount? Like, I talked to a patient of mine who was paying out of pocket 2-3 times a week to go to a chiro. And sorry guys. And he then didn't get his issue fixed, and that was after months. So he came to me, and I'm not knocking that clinic. I'm not knocking anyone. What would happen is he would go in, he would get a heat pad and a stim for 20 minutes, right? My little sister could do it, who's not educated in the field. I mean, I could set up the parameters, but she could do it and put it on the person, right? And then the chiro would see them for 15 minutes, tops. And then be like, okay, you're good to go. 2 times a week, sometimes 3. How does that make you functional? It doesn't. It really doesn't. I don't even have stim with me anymore. Well, I do for some cases, but it doesn't translate into what it is you guys love doing. So for instance, I had a talk with one of my patients today. I could do all the Graston, I could do all the massage work, I could do all the manual therapy treatments, which has its place. However, you can get all the deep tissue massages in the world, and it's not knocking massage therapists, but how does that return you to sport? How does that return you back to doing what it is you like doing? It doesn't. So a lot of what I work on with my patients is specific exercises, corrective exercises, and a game plan each time. And my patients can vouch for this if anyone's on. I will change the program once, probably every time I see them, or if they email me and there's any type of update. I am changing the program that they are doing. I am religiously changing, just like a meal plan. If you have a good coach, he's going to change and he's going to adjust your meal plan. He's not going to keep you on the same thing, because your body gets used to things and your body gets stronger and you learn how to progress. But what falls through is You go to PT and you'll hear it. I go to PT, they put stim, they put a hot pack on me. It feels good for the time that I'm there. Blah, 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 blah. They take me through some exercise and that's it. And I'm on my way and I'm home. 3 times a week. I don't know about you, but I don't have time 3 times a week to go. Thank you, Sean. So what does that do? It doesn't do anything. It doesn't translate into your training. It doesn't make you strong. So again, you can get all the passive modalities in the world. You can get massage. You can get Graston. You can get cupping. You can get da 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 da. But if someone doesn't give you corrective exercises and a game plan to get you back to doing what you're doing, well, you're back into a revolving door. Congratulations, you just gave them your whole bank account. And that's I'm not trying to be mean and I'm not trying to call people out, but that's what the setting's like. It's an insurance game. You know why? Because insurance pays probably $20 out per session. So that's why you do not get an hour and a half of one-to-one care when you go to an outpatient setting. And I've tried it. I've tried that. I've tried the insurance game. And they will pay out literally $20 and they think you're worth $20. When you come and you get treated by me and you do an hour and a half session, it's not 20. I think going for stim and a hot pack and a couple exercises isn't even worth $20. So you know what? The insurance company is right. But that's why they book 3 to 4 or 4 to 5 patients in an hour. When I did my orthopedic rotation, I think I saw max 4 or 5 patients in an hour. That's crazy. I would have like 15 minutes to do an eval on someone. If I even did it like without rushing through it, right? Or got through what it is I wanted to check. And then you miss a lot of stuff. And that's where I think the health field really needs to turn itself around, because if not, it's going to be a revolving door. And that gets me on the topic. I know it's 7 o'clock. I'm going like over an hour. However, that gets me on the topic of something that I think I want to share to you guys that I don't think necessarily all of you guys know what I started working in or what type of setting I started working in when I first came down to Florida. And it's actually taught me a lot, and it's taught me to strengthen my skills as a clinician and who I am now. So the company that I've been with for 2.5 years is an outpatient setting, and we work with addicts in recovery. Yeah, crazy. People are going to be like, what? So how do you do that? Well, I'm working with addicts that are actually in the recovery process. So they're out of detox. They're on the way to getting clean. They're already clean. But they're dealing with a lot of stuff. They're dealing with a lot of stuff psychologically. They're dealing with a lot of stuff between trauma, between marriage, divorces, child support, child abuse. They might have previous injuries, and that's how their addiction started. So these people have gone through trauma, rape, women who have been through, the system in terms of their body being sold. And you have to, as a therapist, show them what healing touch is. I can't just go in there and start rubbing them down and working on them hard. I have to, like I said in the beginning of this whole thing, I have to shut their nervous system down. I have to rewire their nervous system. And for me to be able to do that and work with someone who's been through so much trauma has really strengthened my skills as a therapist, and has showed me that if I can work with this type of population, I can work with anyone out there. Because it's amazing the amount of stories and the amount of lives I've touched outside of it. And I didn't think I was going to. So, I had someone who's now 2.5 years clean get hurt on the job. And where did he contacted me outside of that job. He knew I had my own practice now and came to see me. And knowing that he did that instead of calling and getting high, that's important. So the fact that I can change lives like that too on my own is huge. And if we can change that medical field, if we can change, physicians prescribing pills right off the bat because your back hurts, or we can change them seeking it, I think we can really change this profession. And I'm hoping that I can do that. So anyway, I got 30 seconds remaining. Thank you guys so much for dealing with me talking, but I hope you guys learned something. I hope you guys got something. I'm going to try and do these regularly so you guys have the option if people miss it. and I will put it on my YouTube, so if anyone did miss it, it'll be up there for you guys to watch. I don't know who's going to watch an hour of it. Maybe some of you will, and I hope you do. But thank you guys. I love you all. And thank you so much for the support. I really appreciate it. Have a good night, guys.